am Niela Badayos, and today I'm going to perform assessing the uterine fundus, fundal massage, and Lochia determination. Definition: fundus is the top of the uterine round portion of the uterus found at the top. It is found higher on the uterus than the entrance of the fallopian tubes on the uterus. It is formally known as the fundus uteri, or known as the roof cavity. Involution of the uterus. It is the process of reduction of the uterus to its normal non-pregnant size and state following childbirth. Then next is Lochia. It is the vaginal discharge that occurs after delivery during the postpartum period. This is basically the uterine wall shedding its lining after birth. The uterus is healing and is returning to its original pre-pregnancy size. Objective of this procedure are to determine location and firmness of uterus, to assess and identify deviations from the norm, to assist and support the woman's normal recovery by immediate intervention. Equipment used for this are gloves, perineal pad, and linen saver pad. Now let's proceed to our procedure. First, we will explain the procedure. We will going to wash our hands and provide privacy. Explanation relieves anxiety and facilitates cooperation, while washing hands prevents contamination and privacy prevents embarrassment and lessen anxiety of our patient. Okay, ma'am, good morning. I am Niela Badayos, your attending student nurse for today. I am Niela Badayos. Are you Miss Catherine? Okay, so today, ma'am, I'm going to perform I will assess your uterine fundus, and I will do a fundal massage, and also I will going to check your Lochia later. Okay. Then, we're going to ask our patient to empty the bladder if she has not voided recently, as full bladder may displace the uterus, resulting to incorrect position of the uterine fundus. Okay, Ma'am Catherine, have you kapangihi na ikaw? Okay, thank you. Then we will have our patient assume a supine position with knees slightly flexed, or a dorso-recumbent position, as this position relaxes the abdominal muscle. Okay, miss. I-flex ko lang inyong matiil. Okay, pwede ka nakastay sa munang position. Okay. Thank you. Now we will put on a protective gloves, lower perineal pad, and we will observe Lochia as fundus is palpated. We'll use glove as it protects us from any spread of microorganism and contamination of any secretions. And careful observation can clearly determine any possible hemorrhage earlier. Okay, miss, as ahon ko lang yung mobayo. Then we will place one hand on the lower uterine segment, using other hand, and then palpate abdomen until top of the fundus is located. One hand palpate while the other hand support the base of the uterus to determine uterine firmness or uterine atony or bogginess. Supporting hand at the base of the uterus will prevent uterus not to come out or displace, while the other hand palpate the location. If a boggy or uterus is not firm, then we'll massage lightly in circular motion the uterus until firm, while the other hand supports the base of the uterus. We will perform uterine massage every 10 to 15 minutes for the first hour after birth, and every 30 minutes during the second hour. After the first 2 hours, this massage usually happens every 4 to 8 hours until discharge. Massaging the boggy uterus in circular motion will promote firmness and muscle contraction that could help expel excess uterine fragments and is still remaining, to reduce risk of postpartum hemorrhage and assist uterus in shrinking back to its pre-pregnancy size. Bogginess is a sign of possible postpartum hemorrhage which needs immediate intervention. Then we will determine height of the fundus, measuring height from the top of the fundus and finger breadths above, below, or at the umbilicus. To detect the shrinking back of uterus to normal size during pregnancy state. Then we will determine whether fundus is in midline. Point of origin is umbilicus. Deviation from proper location indicates a full bladder. Then we'll document the consistency and location of fundus. Consistency is recorded as fundus firm with massage or fundus baggy. We'll record fundal height, example U -2 or U +2 finger breadths below or above the umbilicus. Now we're going to listen on a bowel sound. Okay.
This
Helps monitor the condition of normal uterine involution. Proper documentation promotes proper intervention that could be done immediately if there is a problem noticed on the chart. Then we will make our patient comfortable, as conducive environment enhances healing process as the patient experience comfort. Okay, miss. Kaiuhan ka lang, inay position. Miss Catherine, komportable ka lang sa buong position? Okay, thank you. Now, for evaluation, assessment of uterine fundus has been objectively provided and recorded. Assessment of Lochia has been effectively done, and any abnormalities has been reported if it needs any interventions. That's all. Thank you. Now, for Lochia determination, the first Lochia from day 1 to 3 is called Lochia rubra. It has a bright red, bloody consistency, and freshly odor. It temporarily increased during breastfeeding and on rising. It is large for about 6 inches and 50 to 80 ml. And from an abnormal Lochia rubra, it has numerous large clots. It has foul smell and a saturated perineal pad. It is also large from 6 inches and also 50 to 80 millimeter. And next, from day 4 to 9, it is called Lochia serosa. It is pinkish brown and has a serosanguineous consistency. It is moderate, 6 inches stain and 25 to 50 ml. For a abnormal Lochia serosa, it has a foul smell and a saturated perineal pad. It is large for about 6 inches and 50 to 80 ml. And next, day 10 to approximately 3 weeks is called Lochia alba. It is creamy white and freshly odor. It is scanned for about 2 inches stain and 10 ml. For an abnormal Lochia alba, it has a foul smell, persistent lochial discharge over 3 weeks. It returned to a pink or red discharge. It is small for about 4 inches stain and 10 to 25 ml. That's all. Thank you.